Welcome back to Gemstone Podcast. I go by LP. I have Shy with me. Zach can be with us today. Before we get started, please make sure you go share and follow our podcast on all platforms. We're currently on Apple Podcasts, Amazon Podcasts, Pandora Podcasts, and Spotify Anchor. If you would like to send us fan mail, please send us fan mail at gemstonepodcast@gmail.com. That is gemstonepodcast@gmail.com. Also, make sure you follow our Instagram page at Gemstone Podcast. I believe right now we are going through a rebranding and restructuring phase in our social media platforms. So please make sure you like, follow, and share our Instagram and other social media platforms. I think YouTube is coming soon. I believe we're currently working on that. We're gonna have visuals dropping. But Shy, how you doing today?
Yeah, I'm doing really well today. A lot better since the last time we recorded. So yeah, I'm doing well today.
That's good. That's good. I wanted to jump into a topic real quick. I didn't want to take too much time. I didn't want to waste no time. But one thing that's been happening right now, we see a lot of things going on with our administration, our Trump administration has made a lot of changes to a lot of different things in our federal republic. His attack on healthcare continues. He's already went ahead and started cutting some funding on, governmental funding insurance plans like Medicaid, CHIP, Cal Ames, Medicare. But that has been providing huge impacts when it comes to, hospital coverage and clinic coverage. We got rural hospitals, you got county hospitals, you got FQHCs, you got community health centers. FQHCs are federal qualified health centers. You have community health centers, and you also have, mom and pop standalones that really depend on Medicaid, really depend on Medi-Cal, really depend on SNAP. They depend on so many different insurance interventions or different type of government funded insurances to, meet some type of return of investment. But his big beautiful bill that he signed on July 4th has cut $2 trillion in Medicaid cuts. And, over the that's supposed to be projected over the next decade. That's how much they're going to cut, 1.2 trillion over the next decade. And it's reducing coverage and funding when it comes to health. Now, you're probably wondering, like, why are we talking about this? Why are you seeing this? And why are you talking about rural hospitals and county hospitals? Because that impacts them a lot. Rural hospitals, they really depend on a lot of Medicaid coverage. Being an individual who've worked in a rural district before, I'm not going to say no entity names, but some systems do not take Medicare, do not take Medicaid. They do not take government funded insurances. And that's why you have these other entities like federal qualified health centers, community health centers, because they are the entities that take on that type of insurance and provide primary care services. Now, if rural hospitals lose that 1.2 trillion in cuts over the next decade, that means several individuals are going to go without getting medical care, which means we have a chance of an increase of 300,000 plus people with having increased chronic illnesses like high blood pressure, cardiovascular sickness. The biggest one is diabetes. One of the biggest chronic illnesses that we have to manage in our country is diabetes due to some of the foods in which are being across the grocery aisles. So we have 300,000 that has a risk or at risk of now losing their Medicaid, but not only that, not being able to have their chronic illnesses managed. And that's just adults. We're not even talking about the kids yet. That's 300,000 adults. Now, when we get to the kids, we're talking about 1.2 million children at risk of not being vaccinated effectively in rural communities. Now, one thing you got to understand when it comes to rural demographics is that they already are behind the eight ball, so to speak, when it comes to having best practices or best informed interventions to adhere to illnesses due to them not having a lot of preventative education, so to speak. That's why you see a lot of mobile buses, mobile vaccination units, street teams, in rural communities due to them not having a large opportunity to receive proper coverage anyway. Now, that's rural. Now let's get to county. Now, the county level, that's different. That's like the urban area, the urban district. So, Shy, the best way I can put it, Houston would be considered, they got a county hospital. But if you go out there to, what's that little Crockett? Crockett is a rural community. So the resources that Crockett's needs doesn't always mean Houston County or Harris County will need the same resources, because obviously it's more people there, it's more insight there. They have just a bit more. But the underserved population has a higher percentage in the county level. So when you think about Medicaid rollbacks or these government funded insurances being cut back in the county level, that's big, because that means the shifting of cost in the local systems is going to skyrocket. If the county hospital can no longer cover this well child visit at 4 years old, or cannot cover a woman's wellness check or a man's healthy visit anymore, then now you have to go to the privatization hospitals, where now they can increase their costs and make it more unsustainable for you to have some type of sustainability in your health, whether it be physical, mental, optometry, dental, whatever it may be, because they do have county services for all sectors in health. But with Trump's big beautiful bill, this man is crazy. You'd have 500,000 people in the county level, that's 500,000 at risk of losing their Medicaid. But not only that, that means 500,000 now are going to have at risk of now having increased comorbidities or not having effective ways to get treated. Now, you're probably thinking, like, what can we do? Does this go to SNAP? Does this go to CHIP? Yeah, it does, because SNAP is in conjunction with government funded services. And somehow it's been linked to the insurances as well. So it's CHIP. They're all linked to it. And you also have to think of housing, because I know now he's having an attack on housing, but I'm sure I think you're going to get into that a little bit later. Housing. If you're receiving these services like SNAP, CHIP, Medicaid, AIMS, all these different government funded assistance programs, if they start cutting Medicaid, Medicaid is a founding pillar for SNAP, for housing. Most individuals who qualify for those benefits also have food stamps, also have housing, or quote unquote, you get placed in housing, like you get a voucher, a housing voucher, whatever it is, to live in what is considered a Section 8 living space. And sometimes those are nice communities. If he cuts Medicaid, that means those interventions that are put in place that help people, kind of, stay on their feet so they're not homeless or they're not going without food, that's going to be cut too. So the difference with rural and county, it's just a numbers game. Obviously, the rural community doesn't have the capability or the necessities anyway, because they're rural. They don't really have the understanding of preventative education. You remember, Shah, we was having a conversation on a previous segment. We was talking about Kamala Harris and Trump when they were running for the presidency. And I was like, man, I get what y'all saying, but what needs to be discussed is these preventative measures, because a lot of individuals don't understand the preventative measures surrounding the coverage or the resources that they have in place. Well, he's already about to cut. He's about to cut half of those resources in half just by eliminating 1.2 trillion in Medicaid costs, because a lot of that is associated with it in those divisions. So the main part of my discussion we had many months ago, he already has his attack on. And it's really going to hit the rural hospitals, I feel, harder. I feel like the county level, just because it's urban, you have a lot more nonprofits, a lot of more sustainable interventions. Like, you have more organizations like nursing organizations or back to school organizations or healthy me, healthy him organizations that's trying to assist in ensuring that we're mitigating health, like health illnesses, or that we have healthy people in underserved communities. Well, that don't happen in the rural. The rural hospital is that intervention. So if you start cutting those programs, you're going to see FQACs start to close down. You're going to start to see community health centers close down, because they bread and butter is the underserved. They get a check from the federal government every year for the services rendered to undocumented, to those who don't have the finances, who are 200, 300 under the poverty level, who have children who are not insured, but they qualify for the sliding fee scale. All of that is now in the next decade going to be taken away. So it's really scary, because we're going to have a country, and I said this to me, I said Trump is at war internally with his people. He's not at war with nobody else. He's at war with his people. He's at war with his people. He's at war with the internal government. So all this is an attack on who? The government, on the state level. because each state has a different correspondent in how they are going to adhere to the underserved population. Texas has something different. California has something different. Arkansas. All these different states have different approaches into how they do this. Now he's cutting them off at the knees, which some Republican states will love, because I know Texas will love it. Oh, Hot Wheels gonna love it. Hot Wheels, this is right up Hot Wheels alley. Cut down some of these programs, especially with one of the largest systems in Texas health. Like UT Health. That's a huge health system. They got a school of medicine. They have so many different schools of medicine. They have so many different partnerships. They even have partnerships out there in Florida, which is crazy. But he loves that, and he's a strong supporter of that. So I just want to bring this to light, and then discuss it a little bit, just to see what do you think is, the issue, or what can we do as individuals to try to mobilize and, be kind of productive to try to, try to help our people, because this is going to really hit the Black and Hispanic and underserved community hard.
Okay. So my first thought is, first of all, we have too many public officials, and such as President Trump, in office that is unrelatable to the people, right? A lot of our public officials, a lot of our public office people kind of inherited the office, or they grew up in really rich, like Trump grew up rich. He's never been poor a day in his life. So it's like a lot of these people do not fully understand the fights employs of an average American citizen, or an average person coming to this country for a new life. So that's my first thought. Secondly, when they look at these programs such as Medicaid, Medicare, they think their mind directly goes to Black and brown, mostly Black. I probably say 60 to 70% of their mind goes to Black, because in their heads, which is not true, but it was kind of started to dismantle the Black family prior to the rest of the races mobilizing in America. Right. So when they think about these programs, it's like they're reversing a curse that they started, right? They started these programs to dismantle Black families. If you were getting housing, or Section 8 or Medicaid, you couldn't have a husband in the house with you and your children, and then they started to make TV shows to promote single mothers, making I don't need a man, blah, blah, blah. And that kind of instilled in us for many generations. And now they're trying to reverse that. So it's almost like they're trying to reverse the impact, and they think in their heads that it's going to affect Black people the most, when it's not. Trump main base is these rural communities of white people, and rural Black farmers too, but rural Black farmers make up a small percentage. And a lot of the rural farmers, Black, brown, white, Hispanic, are mad at Trump right now. But they think it's going to affect Black people, when that is not true. A lot of Black people have built up their lives over the years. We've gotten education. We created generational wealth. A lot of us are entrepreneurs and business owners. And on top of that, outside of that, there's only a small percentage of Black people that's actually on these assistance programs. It's only a small percentage. Our white counterparts beat us, I think it was by like 33%, that are actually on these programs. A lot of Black people, the image is put out there that we're making up the projects and all that stuff, but that's a small, very, very small percentage. With all of these cuts and things that they're implementing, his base that are in these rural areas like Anahuac, like there's areas around here, Brookshire, all them areas like that, those people will be affected the most, because they are the ones that need them resources. If you look at a city like Houston or LA or Atlanta, there's so many hospitals, whether they're for-profit or non-profit, whether they're Christian based, whether they're based off of physicians, whether there's places out here that was opened by physicians. We have hospitals and schools that were opened by physicians. So in these larger cities, in these larger counties, we have more resources to healthcare. We have more options. We have more plans, gold card plans, things of that nature that's accessible to us, that these smaller rural counties do not have. I think they're trying to hinder a certain group of people, but in the downfall of it all, you're gonna hinder this other group of people. Just like with this whole Farmers Act, this situation, these Farmers for Trump situation, they try to cut those budgets to try to take away homestead land away from Black people. I personally have a client that is she has her home, but it's on a homestead. So this woman has about maybe a few acres of land. I forgot how many acres it was, but she has a few acres of land. So her mother's house is on that land. Her grandmother's house is on that land. It's multiple plots, and she lives in Louisiana, and she pays homestead taxes. So Louisiana got all type of taxes. They tax this. To be a small state, they tax you for everything. So she pays homestead tax. She got property tax, a bunch of different things that she takes care of to maintain this land. So thinking that you're gonna cut these budgets to affect Black people know how to survive. Hispanic people know how to survive. At the end of the day, if it came down to it, we know how to take a little bit of something and create a whole lot of something. We know how to take many people. They know how to take. They know how to make. We know how to make food stretch. We know how to make things stretch. We know how to mobilize and especially Hispanic people. They know how to mobilize and live together till they come up. Like we know how to survive. So you're thinking that you're going to affect these people by taking their land and like making it so expensive to where they can't afford it, but you're really affecting your base. You're affecting your base, and when it's all said and done, these people that voted for him and these people that allowed all this to happen, because it's a trickle down effect. It's just not about Trump. He's a small portion in this whole conundrum of BS. But everybody that went ahead with this, you're gonna reap what you sow, and we're seeing it right now. There's farmers, there's people in these rural areas that are not gonna be able to get the assistance that they need. We're already seeing it happen, even though this is like a multi-year plan. We're already seeing it happen now, and it's going to affect not only you, but it's going to affect the generations after you. So that's how I look at it. Like I said, I live in the third largest city in the United States. It's really us. No shade. It's not Chicago. We are bigger. Yeah, we're bigger than Chicago. We have so many different resources. We have free healthcare in some areas. Like we have a lot of organizations that offer free vaccinations, free OBGYN, free pediatric care. We have resources that people in these smaller divisions, an hour or two outside of Houston, around the area, you're gonna have to take a ride to get out here to get there. But I can go up the street from my house and go to a nonprofit and see an OBGYN, or go to a dental school and pay $30 for a fill-in. Like we have resources here, so we gonna be all right. You rural area people that mounted up on your pickup trucks and rolled on out to go vote, get you better eat it.
I think the biggest problem though, Sha, is if I'm not mistaken, I did a presentation of a few months back at the Fine Health Summit, and I believe it said that 90% of the American territory is considered rural, and only 10% is considered urban, and then we have 80% of our U.S. population living in that 10% urban, and we have living in the rural.
Yeah, that's how he was able to win.
Yeah, when you put numbers like that together, yeah, a city like Houston has so many different interventions, and when it comes to Medicare, and you can go here and you can go there, but you got to look at the big picture here. He did his attack on grant funding and medical research first, and now he's doing his attack on the governmental insurances, right? So I'm attacking research and grant funding and if RFPs. Now, those organizations that you like name, they may be funded through grants. They may be funded through RFPs. Right now, a lot of funding is put on pause. It's hard to find funding. And if you use the word underserved, black, brown, indigenous, you're automatically disqualified from funding.
Well, no, I wasn't talking about the ones that are funded by government resources. I was talking about the ones that are funded by donation. I'm talking about the ones that, like, say for instance, in Houston, we have a lot of like millionaires, whatever.
Oh yeah.
And they donate to these clinics, and some of the doctors and nurses are donating their time. They're actually not getting paid. So I'm talking about those kind of things that you have in place just in case you cannot get Medicaid, or if your food stamps are behind. They cutting the food stamps too. People ain't getting food stamps like they was no more. You can go to these different organizations and get a bag of food too.
And one of the biggest things that I want you to focus on is not the concept of the donation of time or the donations to these clinics, because a lot of that comes from I think the word is for philanthropy, if I'm saying it correctly. And they donate and they give money and they do things like that for the underserved and for organizations. Trump, I ain't gonna lie, Trump's smart. He's a strategist because I'm paying attention now. I said this a while back that he strategically is putting everything into place. He started off with we're going after the grants in medical research, in any research surrounding health, and he backed off a little bit. Then he started going out with ICE. You know what I'm saying? And now, not only then he backed off. Now he renamed the Department of Justice to the Department of War. He's strategic, and that's why I keep saying he's not on war with the people. We're just casualties to the game of chess, which is unfortunate. His mission, like I've said, is to create internal chaos within the governments, and that's the federal and state level. Because if I go after your grants, take them. That means state and federal, you ain't got no money now. Now you got to figure out how to make something shape. That means that the state level now has to start supporting these programs. That means they got to dig in their pockets, which they ain't been doing. They've been digging in the federal government pockets. So now they can't do that. They got to depend on themselves. Now I'm going to come after your insurances. Now that's how you really make your money, because who you're billing? You're billing the federal government because we have a pot that you pull from. Now I'm saying we're doing away with that. We slowly cutting these funds back. Now you mentioned these numbers, how it impacts the white community the most. KFF with Kaiser Family Foundation, they are considered one of the pillars when it comes to doing medical research for race, ethnicity, anything surrounding healthcare. They are considered one of the, like, a gatekeeper. They are, most of their research, when you look at a grant or any federal grant, the KFF is always a part of it some type of way. But they put out a study in February of 2025 about the impacts of this in February of 2025. So they was already ahead of the game, saying race and ethnicity impacts of health coverage being lost for people under 65. It impacts whites, the white community, a lot. And they give us these demographics. It impacts the Hispanic, it impacts the Black, the Asian Pacific, and the Alaskan Americans. But you know who it impacted the most? It impacted the Hispanic community the most, because the Hispanic community in the Asian Pacific Islander community is the most uninsured. There's 17.9% of the U.S. population uninsured, and then the Asian Pacific is 18.7%.
Uninsured in healthcare?
Uninsured.
Well,
uninsured.
I would say and to that.
Blacks
So you said this is the Cajun who?
The Kaiser, and then it said the Blacks are 9.7, which I believe that's about right, because when I did that presentation, it was right on that demographic. And then the whites, obviously, are 6.5. And so when you think about that, and his assault on just people of the healthcare system, he's really trying to break it and then rebuild it. Now I don't know what he want to build, but he wants to tear it down. But one thing I will say, and I might get crucified for saying this, because I do agree with, when it comes to pharmaceutical companies and it comes to insurance companies in this country, they are crooked. Those are the companies in this country who are making billions of dollars, and we don't know why and how. And they charge a balloons amount of money for certain things to be done. If you're going in for a heart surgery or a mammogram or a cardiovascular checkup or anything like that, sometimes your insurance will be billed by the health system, and you got a deductible or whatever they say. They might only cover 10%, and then you left with the rest, which is cool, right? But why? Why do I have insurance if you're not going to cover? Why am I paying you monthly by whatever, bi-weekly from my check? that you're pulling from my gross, and you're not even gonna cover my full medical. What am I paying you for then? But I don't know what he's doing, but I can tell you now, hit us out on the government's first, and this next is gonna be on these private insurances. Watch. That's who's getting the bag. These pharmaceutical companies and these private insurances, they are getting the bag.
Well, what I was gonna say was the company that you stated their statistics from. You said it's called a Cajun something.
Kaiser, it's called KFF. It's called Kaiser Family Foundation, if I'm not mistaken. Let me go double check. I could be wrong.
Okay. Sometimes some of these statistics are biased, but I was going to say to that, yes, these people will be cut with from their medical. These people, these Pacific Islander Hispanic people, I don't think they have so many traditional ancestral medicine that they have been using for so many years. So I don't think, like, I still don't think they will be affected as much. Like, they have so many things ancestral that they have used over generations to heal themselves from different things. So I mean, one demographic we know ain't got no historical or generational sauce, if you will. It's white people. So once again, they're gonna be affected the most, and it's gonna be his base. And his base is these rural people in these rural areas and these rich people. That's like his base audience. Then also I was gonna say was in history, in the United States, we saw what has happened to people that have came against the United States government. Whether you work for the government or you was a civilian. We've seen what has happened to those people. We've seen what has happened to people that's tried to dismantle the United States government and how they operate. We have seen the outcomes of people who have tried to do that. That's all I'm gonna say.
And you're saying it's going to impact the rural community, and you're right. And one thing that people have to understand, the rural community is already at a disadvantage because it doesn't have the resources like a Houston has. That's why I gave the example of Crockett and Harris County. It doesn't have the same amount of resources. You have to have a lot of collaboration, a lot of community partners who collaborate together to try to put events on, who try to put awareness campaigns together, who tries to put these different novel interventions together to best support the illnesses and the lack thereof of services that's being rendered in that particular region. But when you think, like I keep saying, Trump is, I hate to say it, man, dude is good at what he's doing as far as creating chaos, because it's so many fires that everyone's trying to put out. You got immigrations, you got housing now you got healthcare, Medicaid, and insurance. Now you got new issues going on with war. He has so many different fires going on that you don't know which way to go. The fire truck is like, man, we only got so much water that we can use to put out these fires. Eventually we gonna run out. But as I said, all of this, if you pay attention, there are attacks on internal things that are associated with the government, federal and state level. He is at war, and he's declared war on the internal seats of the American Republic political system and the governmental system. And I said it, I said that on so many different segments, man. And every time something comes up, and I'm like, dang, here we go again. I don't know what he wants to do. It's as if he wants to burn down the current system and rebuild something different, which is possible, because I know they're doing a lot of redistricting down there in Texas with these seats, with the Republican seats, which ain't right, and that's out of pocket. But we'll talk about that for another day. But and also, that Governor Newsom up here in California, they filed a lawsuit against Trump and his team to stop ICE from coming, and the Supreme Court rejected their lawsuit. So now ICE has jurisdiction to come back into California and start their raids again on capturing or getting the illegal immigrants and busting them up. But with all that being said, I keep saying, man, and you know what, though, Shy? You know who been real quiet? Real quiet, Mr. Tesla. Mr. Tesla been real quiet. I don't know what he got something cooking up too. He cooking on something. He just ain't saying that. He cooking. He in the lab right now. I don't know what he doing,
Yeah,
but he
because
real quiet
Mr.
too.
Tesla being quiet because he getting ready to pull the trigger.
He been real quiet. I'm telling you, he been real quiet too.
He getting ready to
What
run
you
the
call him?
mouth.
Yo,
He getting ready
JoJo?
to admit that they stole the election and he helped them. And then he gonna go back to his country.
What'd you call him? Mojo JoJo?
Yeah, Mojo Jojo. But what I was gonna say to Trump, right? You know, the devil uses. Sometimes the devil will use, citizens such as us to, to move forward evil doing, evil plans, right? But one thing I know about that, once the devil is done using you to act evil and to harm people, he discards you.
Sure.
He gets rid of you.
Sure do.
Your ending is never peaceful. So doing all these things to affect people for no reason, just because you don't like, you might have your own vendetta. At the end of the day, Trump is American, but his ancestry is not American. His ancestry is actually our enemies. So you might have a long-standing issue with the United States government that could date back to the early 1900s. We don't know. One thing I know, taking all these things in place to harm people is evil doing. And it's the work of the devil. And once the devil is done with you, you're gonna be discarded like trash. You're gonna be discarded like meat on the side of the road. So tread lightly with his people.
You hit the nail on the head, girl.
Because Trump, you is 80 years old and your hands are purple.
Man.
My grandmother is 83 and she ain't got no discoloration on her body. I can see.
You gotta stop.
Your hands are purple. Your body is swollen, and you worried about hurting other people. You got a swole body. You swole up like a pig.
Look, so we want you guys, while you listening to this segment today, we want you guys to, give us some feedback. Leave some comments. Go on our Instagram page. It's at Gemstones. At Gemstones Instagram. It's at Gemstones Instagram. And let us know how you feel about this topic, because it's something that's not going away no time soon. Unfortunately, we won't really see the real effects of some of these things that they're seeing with cuts and budget cuts and taking these budgets away and no longer funding research. We won't see the real effects until 2026. Next year, we'll see. Next year, we'll really feel them. Right now, we're hearing about them, and it's like, oh, that sounds terrible. But next year, 2026, we will actually see them take place, because most of the fiscal budgets that are approved are normally approved around May or June. And when you don't have nothing to approve, we will see the effects. So leave your comments. It's been a great segment. I'm going to sign out. Remember, follow us on all platforms. We're on Apple Podcasts, Pandora Podcasts, Amazon Podcasts, and Spotify Anchor. Make sure you like and share our podcast, and like and share our podcast, and share it with a friend, and have a talk with it.